and welcome to the Clinical Liver Diseases video series. CLD is an official digital learning publication of the AASLD. I'm Joseph Lim, Professor of Medicine, Director of Clinical Hepatology at the Yale School of Medicine, and author of the paper Management of Hepatitis B Reactivation, Challenges and Opportunities. I'm joined by my colleague and co-author, Dr. Catherine Mezzacappa, who partnered with me in the development of this paper. This is part of a series focused on current clinical challenges in the management of hepatitis B that is edited by Professor Liu and Professor Gao from the National Taiwan University. What we aim to do in this paper was to provide a summary of current evidence governing the management of hepatitis B reactivation in current clinical practice. First, we aim to define hepatitis B reactivation, recognizing that this is an under-recognized clinical syndrome in patients who have either resolved hepatitis B as marked by the positive core antibody or active chronic HBV infection. We've summarized current guidelines regarding to screening of hepatitis B, including that of the US CDC, which recommends that all US adults aged 18 or older should be screened with 3 tests, including the hepatitis B surface antigen, hepatitis B core antibody, and the hepatitis B surface antibody. In addition, there's recommendations by the AASLD, the AGA, and ASCO, the American Society of Clinical Oncology, that all individuals undergoing immunosuppressive drug therapy for cancer chemotherapy or other biologic therapies should be screened for hepatitis B with these markers. Among individuals who have either resolved hepatitis B or ongoing hepatitis B, there is a risk for activation, defined as either those who have active hepatitis B infection having a 2-log rise in hepatitis B DNA, for among individuals with resolved hepatitis B, either a reappearance of hepatitis B DNA detectability or a seroconversion of hepatitis B surface antigen from negative to positive. The next principle we tried to summarize was the principle of reactivation risk stratification. In other words, who are the individuals that are either high risk for activation, defined as greater than 10%, intermediate risk between 1 to 10%, or low risk, less than 1%. This is going to be discussed in greater detail in the paper, which we'll refer you to, but that major risk stratification principle is that there are important differences between those who are S antigen positive versus negative, and based on the class of immunosuppressive drug therapy. In general, patients who are undergoing B-cell depletion therapy, such as rituximab or anti-CD20, are in the highest risk group, both among S antigen or core antibody positive only individuals. But there's much more nuance with the proliferation of novel immunosuppressive drug therapies, particularly in the classes of JK inhibitors, CAR T-cell immunosuppressive drug therapy, checkpoint inhibitors with PD-1 or PD-L1, tyrosine kinase inhibitors, and cytokine inhibitors. There are also low-risk agents, such as antiproliferative agents, calcineurin inhibitors, and low-dose corticosteroids. We additionally addressed clinical issues, such as which antivirals to use, such as entecavir or tenofovir, which are high-potency, low-resistance oral nukes. We addressed the duration of prophylaxis, such as 6 to 12 months for most individuals, potentially longer for those with high-risk immunosuppressive drug therapy. We also addressed monitoring requirements with liver enzymes and hepatitis B markers, both among individuals who are undergoing prophylaxis with antivirals, as well as those who are pursuing a monitoring approach only. We additionally addressed some of the current challenges and controversies in terms of specific variables that may predict hepatitis reactivation, and underscored the need for additional research to help further characterize the risk of activation with the emerging and novel biologic therapies. So we hope that on behalf of all of us here at the CLD team, I hope you found this description of our paper, Management of Hepatitis Reactivation, Challenges and Opportunities, to be useful. For more information, we encourage you to go to www.cldlearning.com. Thank you for watching.